Hi, everyone. Welcome to Garfunkel Wild FTCA webinar. My name is Jeff Adest. I think a lot of you have heard me speak before. I'm here today with Sandy Jensen, who will also be speaking about the FTCA requirements. Before we get to the webinar, there's just some technical things I need to take care of. Number one is we want to thank Compliance for being co-sponsor of this webinar. Number two is, so you don't need to be sitting and taking pictures of the screen as we're talking, hoping to get all the slides in, and you go to a lot of conferences and see people doing that. We will be providing the slides. We will send you a link in the next couple of days, which is a link to the slides and to a recording of this broadcast. So if you have anyone who wasn't able to make it but wants to be able to hear, they will be able to hear it after. Apparently, we have a YouTube channel, and I'm somewhat of a star on YouTube. I don't know what that means, but I'm somewhat of a star on YouTube. A lot of webinars up there, so it will be available for you. Also, please feel free to ask questions, but just being realistic, given the amount of material we need to cover, I don't know that we'll get to the questions during the webinar, but if you submit the questions, we will get back to you after the webinar. A couple of other things just to keep in mind. We are talking today both about regular FTCA compliance and about preparing for a webinar. Usually at the beginning, I talk about why it's important. Given that we had more than 450 people sign up for this webinar, I think you probably all understand why it's important, so I don't need to go through that. But we will be talking both about the regular FTCA application and about preparing for an FTCA site visit. So one other announcement, as you know, this webinar today is part of a series of webinars. The next one is tentatively scheduled for Wednesday, January 22nd, and that will be on preparing for an OSV practical tips. I know many of you have probably heard about OSVs before and had them. I think you'll notice when you come onto our webinar that different than many others is we don't just spit back the requirements. We give you practical things to be able to do so that you can be in compliance. Okay. Also, we will be including when we send out the slides, some questions. As you can see on the screen here, there are another 7-8 topics that we have listed there. We are also looking for feedback from the listeners as to topics you want to hear, whether you want to rank some of these more higher than others, or the other topics you want to hear about. Obviously, it's better to know what you want so we can talk about what's more important to you rather than what we might think is more important. Okay, so getting to FTCA. So just starting at a very high level for a second, right? So if you're on the phone and you come from a lookalike, FTCA does not yet apply to you. Hopefully will apply to you at some point in the future when you become a full FQHC. But the concept of FTCA overall is that from HRSA's perspective, the federal government's perspective, right? So you have a health center, which is generally in a medically underserved area, medically underserved population. And as a general course, the patients who come to FQHCs do not seek I'll say prenatal, or do not seek the outpatient care that they need in advance, right? The whole idea of an FQHC is making sure that people within the Medicaid population principally can get the services they would not otherwise be able to receive. And so one of the problems and I'll just use OB as the example, because I've had this question come up a bunch of times. So I'm an OB and an FQHC wants to hire me. And I figure out that 30% of the patients, or maybe in some places 70% of the patients, do not ever show up for a visit until their 9th month. Right now, statistically, if the patient is showing up for the first time in the 9th month, again, given the population, the risk of the delivery going bad is exponentially grows as compared to someone who came for all their visits the full 9 months and took care of themselves and was getting regular care. So I need to be crazy to go work in an FQHC as an OB. And as an FQHC, my malpractice is going to be through the roof, theoretically, if that happens, because what happens now when the patient comes and they didn't get all the care they should have, and now I'm doing this delivery, I'm at much greater risk of being sued for that. And so because of things like that, HRSA went out and it advanced the FTCA status to FQHCs. Now, you're all familiar with FTCA, have had it for all these years, you haven't really thought about it, but beyond FQHCs, there are almost no other providers who are covered in FTCA. What FTCA is really about is a truck driver who's driving a truck for the federal government, gets into an accident, federal government will say, we'll defend you, and those are the kinds of cases that they handle. Right? They have typically never handled medical malpractice type cases. So FTCA was a big expansion to be able to include FQHCs. But, and as you know, right, FTCA covers you for malpractice. Just to be clear, because we get these questions a lot, it is not in place of general liability or directors and officers insurance or anything like that. It's purely about medical or dental malpractice. So if a patient is coming to the center and slips and falls on the way in, that is not covered by FTCA. If they are alleging they were hurt by someone at the FQHC, then it would be, the FQHC would be covered. The coverage applies to the FQHC, it applies to all employees, and it applies to certain contractors. If we start getting into which contractors on this webinar, we spend the whole webinar on it, so we'll leave that aside. Anyone has any questions about it, feel free to contact us. So that's the background on it. Now, historically, what happened was you had to submit an FTCA application each year, right? They generally come out in May, and you have to submit it in June, and you have to run around and put together a lot of different pieces very quickly, and we get bombarded, and Sandy gets bombarded with people asking to help fill out the application. To my knowledge, until this year, this was a pretty pro forma process. Right, you got the application, you wrote some words down, you submitted it to HRSA, they looked at it, as long as you had something in there about these activities, and actually, until 2 years ago, risk management wasn't really part of it, right? It used to be just QA, credentialing, claims management, and now in the last couple of years, they've added risk management. Well, what's happened this past year is for the first time, HRSA started rejecting applications, right? So before that, as long as you put something in each box, and there was a pro forma they could check off, there was something in the box, they accepted it. This year, they came back to many organizations and said, no, your application is not sufficient. You need to explain to me how you're really doing this, or show me that the board was involved in it, and show me that you've met all of our requirements. And so I'll talk about this in a couple of minutes, but I'll just mention now, I was actually present at an FTCA site visit. So when we talk about things today that come up during a site visit, these are based on firsthand knowledge. One of our clients, their compliance officer had left, and so I was nominated as their interim compliance officer and actually sat through the entire FTCA site review. So I will tell you more about that, but as part of that, Christopher Gibbs, who's the person in charge, so to speak, of this from a HRSA perspective, told me that they rejected some this year, but that going forward, they will be rejecting a lot more. That, you know, they're understaffed, and so it takes a long time to get through all of them. So they let some of them that were questionable through, but in the future, they will not be letting those through. Now, so HRSA also issued a site visit protocol, FTCA site visit protocol. So the way I would look at this, right, so we gave you a link to where it is, but I'm just going to scare you a little bit, which is that link is to the most current published site review materials. So we all know if you have an OSV, right, there's a compliance manual and then there's a guide, which, you know, sort of, you have all the questions before and got to get them all answered right. So you have all the materials you need. As we were sitting there during the FTCA site review, they were asking us questions, and I'm like, you know, I'm looking at the document you issued, and it's not in here, and you're asking things outside the scope of what you said you were going to ask. And they came back and they said, what do you mean? We have this one. And the reviewers who were there had a more updated application than the one that was publicly available. And so we tried to argue that how could you be coming and doing an enforcement action based on something you never told us we have to comply with? And their answer was basically too bad, right? But that's what we're doing. And we asked why it's not published, and apparently there's an internal process in HRSA where new guidelines have to go through a process before they could be published. So the FQHC was being tested on things that we didn't know about. It was also clear to me that this is a work in progress and that over time it probably will change more. And I think Chris Gibbs kind of agreed with that it will change more. So I will tell you that you should look at these guidelines, obviously, but don't fall into the same mistake of the other FQHCs and assume that's all that's there. You have to do everything that falls into the 4 topics we're going to go through today. Okay, the other thing that's very different when you come to a FTCA site visit, right? So when you have a regular HRSA site visit, you have 3 reviewers who come and spend approximately 2.5 days on site. One of those reviewers focuses on clinical. The other 2 do not focus on anything clinical. And within the clinical, they're focusing on some of the same topics as here, but not to the same extent. When you have an FTCA site review, you're having 2 reviewers who are coming, and both of them are spending the entirety of the 2.5 days looking at these specific things. So when they came to the FQHC I was at, one of them focused on risk management and claims management, the other one focused on QA and credentialing. And unlike many OSVs where the reviewers come in and as they're sitting there start reviewing the documents, I know they tell you to send it in advance, but my experience has been that many times they actually are sitting there reading it for the first time. These reviewers came in and knew it perfectly. They knew everything in the policy, didn't want to hear about the policies. They wanted to know about what are you doing in real life, right? So something to think about is when you have a HRSA review, they're looking for compliance at a policy level. When you have an FTCA review, they're looking for compliance at a policy level, but also for compliance at a practical level. Are you doing what your policies really say you're doing? And we'll go through some of those requirements today. The way I would best describe it for those of you who are in states where you have Department of Health coming in and doing their separate reviews from HRSA, it's basically a combined HRSA review and Department of Health review. So things like infection control, things like safety, they are going to actually sit and walk through all the sites and test to see, a simple thing. You have a soap dispenser. Is there actually soap in the soap dispenser? Do you have logs? Are the logs being kept updated? Are they going to look into your refrigerator and see, do you have any drugs that have expired and what have you done with them? It's much more reality-based and practice-based than a regular OSV. Now, you might say to me, so why would we ever be the subject of an FTCA site visit? So we put up here on the slide the criteria for it. I'm going to tell you that even though they're in different order, the number 1 criteria is the bottom one. Do you have a history of claims? So one of the reasons that risk management was added to FTCA, and one of the reasons why they've all of a sudden started to focus on it, is that, as I mentioned earlier, the FQHCs were never really supposed to be the focus of FTCA. So what happens is if a patient sues you for malpractice, right, and they're suing the federal government, in the process, the people who have to defend it are the people in the U.S. Attorney's Office. So you have assistant U.S. attorneys who are defending this. Now, these are the people who went to Harvard and Yale, who think they're the best and the brightest, and who think they're coming in here because they're, going to prosecute RICO cases or other cases that are going to get them in the news on the front page of the newspaper. I know newspapers are going away, but we'll get them on, on television, on all the news shows talking about them, and you being able to get their face there and show it to everybody they were on the news. The idea of defending medical malpractice claims is probably the worst thing you could offer one of them to do. And from having worked with many of them, they hate it, and they do their best to get out of having to defend these cases. And so part of what happened is they went to HRSA and said, HRSA, you're telling us to defend these cases, but you haven't put in standards to make sure the FQHC is avoiding claims, right? Until recently, I'm not saying any of you would do this, obviously, because you care about patient care, but theoretically, you could have provided miserable care, and there wouldn't have been any difference to you, because at the end of the day, who cares, right? It's the federal government defending it, not you. And obviously, it's not what's happening, but from their perspective, that was a standard that was out there, and so they went back to HRSA and said, HRSA, you got to do something about it. They also went, and over the past year or two, the number of cases brought against FQHCs has skyrocketed. And so from talking to people at HRSA, they have a budget each year for what they think they'll have to pay out in terms of medical malpractice claims. Like any other division of the federal government, there's a budget allocated to them. They blew that budget in the first 2 or 3 months of the year. And so that put them in a very bad place of having to go back to the government and say, give us more money. And so as part of that, they had to agree, well, we're going to go out and do site reviews to be able to see how patients are, how FQHCs, what FQHCs are doing to prevent these cases. And so that's the main focus of it. So if you've had a number of claims in the past 2 or 3 years, you're much more likely to have an FTCA review at your FQHC. Even if you have not, if there have been issues with your application where they were unsure about the application, then they will put you on the list also. And then they also will just be randomly selecting places. So even if you never had a case, you might say, okay, I'll just get off now, because what difference does it make? The answer is that they told us that they will still be randomly selecting FQHCs also. It's not just, having been the subject of claims or having a problem with your application. Okay, so like a regular OSV, it's two members. Oh, here's 2 members instead of 3. There is a HRSA person who comes on site to answer questions. They want documents in advance, and they're going to do tours. At the very end of the presentation, we will give you a list of the documents they typically are looking for when they're doing the site reviews. It's the same general process, a regular OSV. They'll give you an exit interview. They'll tell you the problems. So a little bit different. You don't have the 14-day thing that you have for a regular OSV, where you could fix in 14 days, doesn't go onto the report. Here there's a report, and you get it, and it's about within 4 to 6 weeks, and they give you 30 to 60 days to submit for corrective action. So the next bullet point here is true and not true. So depending on when your HRSA site view, your FTCA site review is. So if you have an FTCA site review, for example, in March, and you submitted your application last year and it was approved, it will not affect your application. However, if you have your FTCA site review, for example, in August or September, they very well may hold the approval on your application until after the site visit. So if they come to the site visit and find major problems, it could impact on your approval of FTCA for that year. One other thing I just wanted to mention before we get into the specifics is that in many cases, right, so most plaintiffs' attorneys don't know about FTCA, never heard of it, don't know anything about it. And so very often our clients get sued in state court, right? As you all probably know, the process then is you have to do a tremendous amount of paperwork. You got to hire an attorney to go in and defend that case. You got to go to the federal government and submit to them 19 copies of 45 different documents. Basically someone's got to take off their job for a month to put together everything that HRSA needs. We have had great success with our FQHC clients who call us and send us a complaint. We actually reach out to the plaintiff's attorney and explain to them how FTCA works and explain to them that if they are going to keep the FQHC in this case, it's going to end up being a delay of 4 to 6 months normally in their case, being able to move forward, and the case is ultimately going to be dismissed. So just dismiss us already now. And I would say that 95% of the time we are able to get them to just dismiss the FQHC or the FQHC physician out of the case up front rather than you having to go through that whole paperwork process. So if you get a claim and you want to reach out to us, we have a lot of experience, like I say, in getting that through. Okay, so that was all background. We are now going to get to specifics, and I'm going to turn it over to Sandy to walk through it.
Okay, thank you. We'll go through each of the 4 topic areas required in the FTCA application, and I'll explain what the application requires and how that differs from the requirements for the FTCA specific OSV. So for the FTCA application, you need to identify a risk manager. I'm sure you already did, and you indicated that person on your FTCA application. What HRSA explained was that they want to see a progression in training for the annual healthcare risk management training. So this person shouldn't always complete the ECRI level 1. They want to see ECRI level 1, level 2. ECRI added an additional level this year. It's sometimes hard to find the right course from ECRI, so you could give them a call. It's listed under the free courses for the health centers. HRSA also wants to see the job position description state that the risk manager's daily duties involve risk management activities. So take a look at your job description and make sure it says that now. As Jeff indicated, sometimes when I suggest recommendations or make recommendations to change policies and procedures, I'll hear back, we've been submitting the same thing every year and we always get it approved. But they're really becoming more stringent and they're going to start rejecting. So it's important to go through your policies and procedures and make sure the required elements are there. You have to attest that you have a system-wide risk management program. And the program is supposed to identify risk and take steps to reduce the risk that you've identified. And it has to address certain activities. And it includes triage, scheduling, missed appointments intake. So this would basically be included in your risk management plan. And for your risk management plan, for the plans that we draft, we include bullets on each. And it could be the health center makes available appointments through the day for walk-ins or sick visits. We follow up on missed appointments. There's tracking and follow-up. But the FTCA OSV takes this well beyond this.
Well, I just want to mention also, so when they do a FTCA site visit, something very different than OSV, right? In OSV, you control who they speak to. So they only speak to your medical director, your CMO, whoever that is. When they're doing the FTCA review, they walk through the site and they will stop people and they want to talk to the person who's doing the triage. They want to talk to the person answering the phone. Want to talk to the person dealing with the following up with the no-shows. So it's many more people you need to train and many more people with an opportunity for someone to say something that's going to get you in trouble.
And make sure you have your very best employees working those days when they're there. So for the FTCA specific on-site visits, you actually have to produce these policies. So the blurb in your risk management plan wouldn't be enough. You have to have a walk-in patients policy, a no-show appointments policy. And these policies should basically, for example, the walk-in patients policy, you should say that you make appointments available, and it can be appointments for people that have an urgent issue. But another key point is don't consider only medical. Look at all the departments or in-scope services. Sit down with them and determine what they do, because they're looking for a system-wide program, not just medical. For your no-show appointments policy, so for this one, what I usually get back when I ask to see a policy is something from maybe dental or OB that says, if you miss 3 appointments, we can determine to suspend you or terminate you as a patient. This is not what they're looking for at all. What they're looking for is that you have follow-up. And for those patients that you determine you should follow up on because they missed an appointment, maybe someone that's in chronic care management or someone that misses a behavioral health appointment, that patient isn't lost, that there's a closed system. You've determined that they didn't show up and you need to check on them and make sure they're okay.
Right, and there is some room in that. It does not mean that every single person who doesn't show up you need to call, right? You need to be able to show a risk strategy for these patients we need to and others we don't. You can't just say we determine that. You need to have something written that describes it. Also, just want to jump in. We keep getting questions. I guess some people got on a couple of minutes late. The slides and a recording of this webinar will be made available. We will send out something in the next day or two with a link to both of those.
These are additional policies that are required for the FTCA-specific OSV, the phone triage, urgent care triage. So in drafting these policies, it seems like you can have one policy that addresses all of these, you would think, because they're very closely, some of them deal with the same issues. However, I created separate policies because I specifically asked a question. Well, for example, they require clinical protocols, and I said, well, if a health center follows up to date, is that sufficient? And the response was, if it's requested in the protocol, turn it in. Whatever is requested, turn it in. So in an effort to give them exactly what they asked for, I created separate policies on each item. So each topic had a different policy. For urgent care triage policy, one thing I wanted to note about this, it has to include a process for patients who telephone with an urgent issue. So if the patient calls and a call center agent or a call nurse determines that the patient should go to the emergency room, HRSA wants to see that the patient is kept on the line and someone from the health center makes the call and stays on the line with the patient until the EMS shows.
Right, and just to clarify, urgent care here does not mean, the definition in many states that you think urgent care means after hours, you're available to people. Urgent care for them just means anyone who comes in who has a possibly urgent condition.
Right, and again, it's really important to consider what each of your departments do and not just focus on medical.
Right. I'll also just say, based on some of the other questions we're getting, so we're going to leave this to the end, but like I said, there was a list of policies you need. We have samples of any policy you would need for an FTCA site visit, and we can help you, if you're going to have one, we can help you prepare, not just from a policy perspective, but from a practical, how do we get ready for this perspective.
Okay, so there are a lot of slides, and we've made them really detailed so that you could use it as a reference. And sometimes when I listen to webinars, there's just bullets with one word, and I don't know what they were talking about. So our slides are really detailed, so you could go back and look at them. So if we're moving quickly, you will get a copy of the slides. So continuing with the FTCA application requirements, you need to complete risk management training. That's part of the program. So your program or your risk management plan has to include topics in these areas. Completion of quarterly risk management assessments and reporting to the board. And one note for the on-site visit, they want to see documentation that your board received risk management training as well. That could be once a year at an annual retreat or a presentation to the board specific on risk management training that's documented.
Right, and so one of the things that comes up with regard to that is you'll say we do training on infection control, we do training on safety. They are looking for training on FTCA and avoiding claims. It's so the typical Department of Health type trainings that you do probably are important, but probably will not be sufficient. They are looking for FTCA specific training as well. Again, we have training materials available for that if you're looking for it. I will tell you that in preparing, the training becomes a very significant issue because when you submit your regular FTCA application each year and they ask you to do training, the answer is you write yes. And if you have 150 employees and you got 35 of them who you trained, you can say you do it. When they're coming in to do an FTCA review, they're looking for close to 100% compliance on training. So, and they're looking specifically for the people who would most likely be the ones committing the malpractice, right? So we often come to FQHCs and when you look at it, the risk manager training, yes. So the front desk people and the secretaries and the administrative staff all took that training, but none of the providers took the training, right? So that you're kind of missing the point of what they're looking for. And we actually have separate training that we do for providers, which is more extensive than the one we do for everybody else.
It even gets worse because so your risk management training plan for the training, or your risk management plan for training, you have to outline your process to deal with people that haven't completed the training. So your plan can say the risk manager will identify those that have not completed training and will require them to complete it within a certain period of time. And if they don't, they could be referred to human resources. when the surveyors come in on an FTCA site visit, they said that they would look at the training plan to see those that didn't complete it. Then they'll ask for those credentials, they'll ask for the human resources file to see if any action was taken in accordance with what you said you do in your risk management plan. We only have bad news for that. So, as you all know that submitted the deeming applications, there's a major focus on the tracking policies, referral tracking, hospitalization tracking, and diagnostic tracking. And on its website, HRSA has a technical assistance resource document that sets out the elements for these tracking policies, and it's available at the link there.
Right, but just with regard to these, this is probably the hardest thing you need to do for risk management, because what they want for this is they want to be able to see that you did it. And actually, this is not just limited to the FTCA site review. This is actually for your application. They've started to look at this. So when you say you do diagnostic tracking, right, so the patient never went for the lab, what do you do to follow up to make sure the patient went for the lab or the patient went for the x-ray? Right, what do you do to follow up to make sure the patient went for the referral? And just saying we have a policy about it and not being able to show practically what you did is going to be troublesome going forward. So you need to think about how you actually are going to do it. And again, we can provide tips relating to that.
Okay, so these are the elements that should be in your tracking policy. So what they're actually looking for is that you have a log or some other document that tracks these elements.
Right. Now, just keep in mind, one of the things they made better is there used to be a requirement that if any one of your patients was in the hospital, you needed to know their status. They've now changed it to be only if you actually sent the patient to the hospital. So that makes it a lot better. But still, if you don't have a shared EMR, you don't have access to the hospital's EMR, and then you need to have a person designated to be able to keep track of that. And if they're doing an FTCA site review, they will pick a random date and say to you, show me your hospital log for February 14th, and you actually have to be able to produce that document.
So Jeff touched on it. For your FTCA specific site visit, you have to keep the log and be able to identify patients that were sent to the hospital. In addition, you have to, staff responsible for tracking could be interviewed, and for the health center that we were with, they were interviewed, and they might be asked to provide a demonstration. So let's say you get a call in that provider A sent a patient to the hospital, show us what you would do. So, you know, it's very important that the responsible staff is actually following your policy, because you could have a perfect policy and your policy could list all the required elements and, you know, meet FTCA deeming application. But if your staff does something different, you're going to be found not to be in compliance. Moving on to referral tracking. These are the required elements for the FTCA application, defining a referral type, whether the patient is requesting the referral or if it's a provider requested. Again, they're looking for a log. And these are the items that they specifically want included. Status report just means that there's someone that's periodically checking and determining what the status of the referral is. And patient compliance is, did the patient keep the appointment, or do you need to follow up with the patient and offer assistance in rescheduling? The policy also has to include documentation in the patient's medical records. So in addition to keeping a log, make sure that there's also information maintained in the patient's record.
So I forgot to say this at the beginning. So like Sandy is looking at me, we understand that we're giving you a lot of bad news and a lot of things where you're probably sitting there thinking, okay, I have to run a health center and treat patients. Do they have any idea what these requirements are and what they're imposing on me? And we understand that. Unfortunately, we don't make the rules. It's our job to tell you about the rules. But like I said, this doesn't have to be as overwhelming as it sounds, because we can help you with all and every one of these aspects.
So the FTCA-specific OSV, in addition to the elements that were outlined for the application, they want to see a process for urgent referrals versus routine referrals. So what I've seen for this is that for urgent referrals, sometimes instead of just referring, making a referral and giving it to the patient, and the patient makes the appointment, if it's urgent, center staff might schedule the appointment for the patient, and then it's quicker turnaround times that the report is expected. Again, just like the other tracking policies, they want to see a log or other means to track referrals. Staff that are responsible will be interviewed. They might be asked to demonstrate. And this is not required by the compliance manual, but they may ask you if you and how do you track referrals made to your own health center. So if a patient is not your patient, but a referral was made to one of your providers, do you track that? The last tracking policy that is of particular importance and focus is diagnostic, lab, and radiology test tracking policies. So you have to make sure that your policy handles both radiology and lab. Sometimes it just talks about lab. I've seen a policy rejected where you had one policy that dealt with radiology and one with lab. They wanted it combined into one. Those are the tracking elements. Again, that's what you should be tracking in a log or some other, through some other means. So other issues that have to be included in your policy, how to communicate the results back. You have to mention that there's a process to designate a backup provider. So this is especially important for critical lab results. If you know that a provider is going to be on vacation, who's going to receive those results and communicate it to the patient? We're never popular when we talk about this, Jeff. So there's no good way to say this, but HRSA wants to see that you communicate all results back to the patient, including normal.
Right. So usually when I say this, and now we're doing it on a webinar, so it's a little bit easier. Usually I say it and I duck as I say it.
Nothing.
So many FQHCs, the policy is if there's an abnormal result, we call the patient. HRSA requires that you contact the patient even if there is a normal result. That doesn't have to necessarily be a phone call. It could be a letter, a postcard, or something. If the patient is scheduled to come back within 10 days, you probably get away with that. But if someone's coming for a visit and won't be back for another 6 months, you can't just say, we'll tell them at the next visit. So you need to have some process for being able to deal with this.
So for the FTCA specific OSV, so for diagnostic tracking, they'll look at your log or however you document it. And then for this, like, they'll see whether providers are following the policy. So for example, if you say that you track by means of, you use ECW and the providers get a jelly bean that shows that they have a result, they'll look and see whether the provider followed up with that and read the report and communicated the results back. And if they didn't, then you didn't demonstrate compliance. So again, you have a perfect policy. Your policy has all the elements that they want to see, but your providers aren't following it. So they'll look at that and you will not meet this requirement. Critical values are also an important focus of reviewers. So what they wanted to see in the policy is that you attempt to call the patient. Let's say the patient doesn't answer the phone. You then move down and call the emergency contact. You also can't reach the emergency contact. Your policy has to say that there's an attempt to reach the patient personally. You'll either send center staff for a home visit, or you'll call the authorities, your local authorities, to try to notify the patient. That way. Okay, so back to FTCA application requirements, you have to have operating procedures. So that's just your day-to-day activities. And they have to include identifying the areas or activities of highest risk. So, I mean, you could do that by looking at your claims. Some activities or services just inherently are risky, like OB or dental. And then you mitigate those risks through clinical protocols or supervision. So for clinical protocols, I had mentioned it before, as part of the site visit, you have to submit department-specific clinical protocols. So what they're trying to see is that you have protocols that say that your providers comply with the most recent standards and guidelines of, for example, the national associations like ACOG. You can even say that, you know, in those protocols that you have up to date and everyone has a subscription to it, but you have to submit something. So again, your operating procedures have to include all of these elements.
Near misses is a very big thing for them. They come in and they ask for a near miss log, and if you show them you have nothing, then they're not going to believe that, right? A near miss, you know, in the hospital situation would be that you almost operated on the wrong arm, right? But an FQHC situation would be that, for example, we had a provider prescribe a prescription, and then before, you know, like the pharmacy caught that, one second, the patient can't take this because it counter and, you know, act something else they're taking, or another provider caught that before it went out. So they want those to be documented, and not only do they want them to be documented, they want those to go to the board. They ask for proof that the board had reviewed those near misses.
In addition, incidents, this is for FTCA-specific OSB. The incidents are a major focus of the OSB. They'll actually read all of the incidents, all of your incident report forms. We'll talk about this as well in claims management, but they'll ask for an incident management policy, and it should include a tie-in to claims management. So they'll look at your incidents, and if any could potentially rise to the level of a claim or could lead to litigation, they'll want to see that you issued a litigation hold to preserve the documents. We talked about this a little bit. You have to have a training plan. This is right in the FTCA PAL. And make sure whatever is included on that PAL is in your risk management plan and risk management training plan. This year they added that if FQHCs provide obstetrical services, even if you don't do labor and delivery, if you provide prenatal and postpartum care, you have to provide risk management training. They also added that a health center has to provide trainings for groups of providers that perform services that could lead to risk. So it's really department specific. And so what we recommend for that is just, you know, each department hold a risk management training, have a sign-in sheet, and just identify some issues that could be risky. Maybe it could be like making sure that informed consent is taken for dental. It could include some dental infection control. And they also added dental equipment sterilization training, so you can incorporate some of that as well. But just identify some department-specific topics and include it in department-specific risk management training. You have to track your staff attendance and completion of training, so it wouldn't be sufficient just to have a schedule of when trainings occurred. Have a sign-in sheet that shows that the staff person attended, and then your log, make sure it tracks your training plan. So if your training plan says, these are the courses that we're offering, have a log that basically sets forth each of those courses and lists out the providers that have to take each course and then the date that they completed it. And as I mentioned before, you have to include a process on what you'll do if you determine that some of your staff failed to complete the training. I had mentioned that before about looking at the HR files for those that didn't complete the training. This is not new for the FTCA application. You have to do quarterly risk management assessments. They should include data and trends. For example, did your complaints or grievances go up in an area, or incidents? How did you do in that quarter compared to the other quarter? You can have risk management assessment reports or just report out in your risk management or QA committee meeting minutes, but make sure you call them risk management assessments.
Right, so just a couple of tips relating to that. As we come to many FQHCs and see that you have quality assurance and separately have risk management, a strong recommendation is that all of your meetings and all of your minutes and all your reports say both QA and risk management, because there's such a strong overlap between them. And this way you cover both, and something you might not think of as being risk management, HRSA would, and you can get credit for it. Also, you need to make sure those reports are going to the board. Right? We very often find that you have great QA activities and great risk management activities. The board doesn't know anything about it, and you need to get that in front of the board. Because if it's not in front of the board, then HRSA says, okay, if the board didn't know anything about it, that's the same as you not having done that.
Okay. For the FTCA OSV, infection control, Jeff had mentioned this, infection control is huge. It's a major focus, and they'll actually inspect and observe and interview your staff. For the health center that we were involved with, they interviewed medical assistants, dental assistants, anyone that walked by is fair game, really. So staff may be asked to know and demonstrate appropriate hand hygiene and use of PPE. They'll make sure that supplies are fully stocked. Equipment should be in working order. They required that staff show competency with use of eye wash station hand hygiene upon hiring and then thereafter. And you know, you can have all the equipment there and it's all in working order, but if your staff doesn't know how to use it, then you'll be found deficient in that area. Also, review your infection control plan and policies. Sometimes they're old and outdated. If your plan is very specific and it says in every area we'll have hand sanitizers, and you're missing a few hand sanitizers in one area, but you have sinks with hand washing supplies, then you'll be found not in compliance because you're not following your own plan. So the governing board, they're going to be interviewed, and they're going to be asked what they know about risk management and quality assurance and all of the major areas. So these are the governing board requirements so that you can go back and review and make sure it's being followed. Right,
and like at a regular OSV where they want to sit and talk to the board without you present, they want to do the same thing here. And here, you know, you just, in a general OSV, you just give the board some fluff information and they're okay. Here, they're going to be asking the board about risk management and QA type issues. So you need to be able to educate the board well and be able to show that you have provided documentation to them throughout the year.
So the annual report to the board, this is a big topic for the FTCA specific OSV. It expands on what is to be included in the annual report. So what I'm talking about is if you look at the compliance manual and the FTCA PAL, all it says is that you have to submit an annual report to the board that outlines risk management goals, progress in meeting goals, and proposed activities. So I'm thinking of the annual reports that we see, and it includes like topic headings for all of that, and it's very detailed. They're looking for even more on top of that. So they want a summary of completed risk management assessments, a description of the incidents, risk management trainings that you've done, a summary of grievances, a summary of claim information, but most importantly, they're looking for charts and tables outlining trends. They want the format to be something that the board can easily review and identify the status of activities within the health centers. Charts and tables are key.
Okay, so we're going to get to the other pieces. We wanted to spend the most time in risk management because that's the newest requirement, and that's where HRSA finds the most problems. We recognize we only have 10 minutes left, so we'll be going through some of the other sections a little bit quicker.
Okay, so for quality assurance, they're looking for a system-wide a plan or policy or program that looks at the quality of services provided in the health center. It includes patient satisfaction and patient grievances and patient safety. For the FTCA-specific OSV, so what we usually see is you have a great QA committee and plan. You guys meet, but it really only deals with medical, and it doesn't include every department. It doesn't. You do behavioral health, but it's not included. You do OB and dental, not included. It should be comprehensive and include all departments. And gold standard would be if a member of each department is on the QI committee. If not, they each have to have their own process to assess quality, and all of that has to be reported back to the overall QI/QA committee. So this is out of the compliance manual and the FTCA PAL. Again, we've talked about needing patient satisfaction and patient grievance processes, doing your QI assessments, and sharing reports to the board.
Right. So just as an example, patient grievance, right, is they consider to be QA, but then incidents and complaints they consider to be risk management. So if you're covering both of those together, you've now hit both QA and risk management on the same topic.
So for the FTCA specific OSV, they'll look at your patient satisfaction results and they'll want to see your patient grievances. So you should maintain a patient grievance file, but it should also include any corrective actions that were taken or what resulted from the patient grievance. You shouldn't just say, a grievance was received on this date. This is what the grievance was about, and this is the person that was assigned to. You have to include what the outcome was. The patient satisfaction and patient grievance should be reported at QI/QA committees and incorporated into the minutes. You have to do assessments. This isn't new. This is for the FTCA PAL. Here are the requirements. It has to be done by physicians or other licensed healthcare professionals using data pulled from patient records, which sounds like peer review. And peer review for the FTCA OSV is a major focus. One of the big points in this section is to make sure that each department has gone through peer review. So if you have medical, behavioral health, and OB, the providers in each department has to undergo peer review, and the board should be informed of the results. These are some requirements for the QI director's position, and you could just review them when you get the slides. For your EHR system, they'll look at all of your policies on an FTCA-specific OSV, including medical record retention and archiving policies. So just make sure these are all up to date. With electronic records, your archiving policies might need to be reviewed and redone. Again, this outlines the governing board requirements. New with the compliance manual is that the policy only has to be reviewed at least once every 3 years. So what I see is that some policies say they'll be reviewed annually. So if you're imposing that upon yourself, they'll look to see if you're actually doing that. For credentialing and privileging, you have to have a policy and procedure in place that includes all the required personnel listed in the compliance manual. So LIPs, OLCPs, and OCSs. For the FTA-specific OSV, unlike a regular OSV where you can choose which files will be reviewed and you pick the best ones, for an FTCA OSV, you have to give them a list of all of your staff. And on the first day that they come in, they'll tell you which ones you have to pull. And just to give you a flavor of how many they'll look at, for a regular OSV, the site visit protocol says no more than 4 or 5 LIP, no more than 4 or 5 OLCPs. For an FTCA site visit, they looked at 11 LIP files, 13 OLCP files, and 9 OCS files.
Right, and different during a FTCA review than a regular HRSA review. In a HRSA review, they let you select which files they want. In the FTCA review, they come and on site to tell you we want to see these, and they actually want to sit down at your system and just randomly skip through and pick numbers out randomly and look at them. So it's not like a regular OS where you can only prepare 5 charts and be okay.
So this is straight out of the compliance manual and FTCA PAL. It's the requirements that you should all be aware of. Same for privileging. For the FTCA specific OSV, they want to see that your policy actually identifies which providers are subject to DEA registration, which must have BLS. Not every single provider needs to have BLS, but you need to identify which ones you require to have BLS, and then they'll look to make sure you are following your own policy. If you have references, they should be from a peer or a supervisor, not a subordinate. So if you have contracts with provider organizations, make sure those 2 little bullets are included in your contracts, and they look at all of your contracts to make sure they're in there.
Right, and so for those of you who may not be aware, if you're contracting, for example, with a hospital, and the hospital sends over doctors to your FQHC, you don't need to credential those doctors anymore as long as you have this language in the agreement with the hospital and the hospital is credentialing them. That generally would not work with a physician practice, because physician practices generally don't credential providers. So it's got to be an entity that would otherwise credential them.
So the compliance manual changed who has to approve clinical staff, and they left it to the discretion of the health center. And when the governing board has delegated approval authority for the FTCA, they wanted to see that the governing board is at least made aware who was given privileges. So the last topic is claims management. So the FTCA PAL, this year you were required to upload a claims management policy. And the policy, the main points that they wanted to see was that you're preserving documents in the event of an actual or potential claim, and that anytime you receive the service to process, you're immediately sending it to the Office of General Counsel. For the FTCA OSV, they look at your claims management files, and they want to see that there's documents in there that show that you notified the Office of General Counsel and you're working with them. They want to see that all documentation is maintained, including the envelopes. They want you to retain the envelopes and date stamp when received.
Right. They also want, if you have a claim comes in and you had done QA review on it before, you had gotten a claim from the patient, so it's an internal grievance, they want that information to be included in the file that you're keeping relating to that.
So claim files should be tracked, and what they were looking for with that is, keep a spreadsheet. So date the claim was received, date you sent it to the Office of General Counsel, if you received any other correspondence, when received and the date. And they also are looking for a root cause analysis. You should do that when the claim is closed, rather than...
Right, that's very important, right? So depending on the state you're in many states there is not a privilege for doing a root cause analysis. That means figuring out what the basis for the claim was, and so you don't want to do that if you don't have that privilege, because you've now given the plaintiff's attorney, when they do discovery, they can ask for that. Now you've shown them why you think you were wrong in doing that claim. So don't do that until after the claim has been resolved.
So the last requirement in claims management on the FTCA PAL is that you're informing patients using plain language that you're a deemed federal public health service employee. So, the compliance manual says you can choose how you're going to do that. But for the FTCA OSV, they looked at your population, and you might have a population that doesn't access the internet. So they'll say, okay, you put it on the internet, on your website, but your patients aren't seeing this notice. So consider that it might come up on the FTCA OSV.
Okay, So just quickly, we have 2 slides here. You don't have to sit and take pictures. We'll send them out, but there's 2 slides worth of policies that you'll need or documents that you will need for an OSV. And then just some quick tips, right? Make sure if you're having an FTCA OSV, it takes a long time to prepare. You can't do it in 2 weeks. It's really, you have to put a lot of effort into it. And then other things are make sure your policies match up with your practices in real life, and we'll be looking at infection control and safety. We want to thank everyone for participating today. Like I said, the slides will go out in the next day or 2. We will get to respond to the questions that were put up. If anyone has any additional questions beyond those that were put up, please feel free to email or call any of us to be able to answer those questions. Thank you for participating.